Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College. Today we're going to continue a conversation we had a few months ago about our health related to our heart and how to keep it healthy. Please welcome back our guest, Dr. Evelina Grayver, the Director of Women's Heart Health at Katz Institute for Women at Northwell Health. She's also Assistant Professor in the Department of Cardiology at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Dr. Grayver, welcome back to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much for having me back.
So for those that missed our first show, tell us briefly about yourself and what makes you an expert in the area of the heart.
I've done all of my training at North Shore. I went into medicine kind of always knowing the fact that I wanted to be in the world of cardiology, but I finished my training in cardiovascular health approximately 10 to 12 years ago. And at that period of time, I was all geared up about my critical care cardiology. And I was the director of coronary intensive care unit, where I saw the sickest of the sick patients. And the one thing that was always sort of striking to me is the fact that the women that were in my unit were always sicker than the men, though that they were actually younger, some of them. They also had very atypical symptoms that with which they would present. And on top of it all, they didn't have the typical risk factors that we would always sort of correlate with cardiovascular disease. So I started to see that more and more and more. And then when COVID hit, I was immediately redeployed into the world of COVID ICUs, and I ran COVID ICUs, where once again, I saw more women with more cardiovascular issues that did not fit sort of the bill that we all studied in medical school. And when I was brought back into the world of cardiology from COVID, I specifically spoke to my health system in sort of the importance of starting the Women's Heart Program, especially when it comes to some of the newer gender-specific risk factors that I started to see. And for the last, 3 years, I have been taking care of a tremendous amount of women, pretty much to the point where my practice is now almost all women practice for women of all different ages. And that is the one thing, Jeanine, that you mentioned, is the fact that, number one, cardiac disease does not discriminate whether or not it's male or female. And cardiac disease does not discriminate whether or not you're young or old, especially when you have some underlying genetic predisposition.
So I wanted to discuss a bunch of topics that we never had time to last show. And if anyone who's listening wants to revisit that first show, you can find the podcast by searching Your Family's Health, WHPC. Let's talk a little bit about heart health diets and what your take is on the best diet to maintain a good cardiovascular health.
So what's interesting about that specific question is that majority of patients, especially women, obtain their knowledge, especially when it comes to appropriate cardiac diets or any kind of diets, from magazines. So just of a note, a funny story, I was at a supermarket and there was a huge display of magazines. And out of 14 magazines, and I counted, out of 14 magazines, 12 magazines had headlines about appropriate diets, right? And this is why so many people are significantly confused, right? Because they don't know. Are they eating plant-based? Are they eating keto? Are they eating, what's the next fad? Yeah. And that is the one thing that I really wanted to sort of discuss at length here. And that is fad diets are not friendly to cardiac disease or to cardiovascular health. Okay, any diet that is going to tell you that you're going to lose 10 pounds in 10 days is not something that is going to be friendly to the heart. That's number one. Number two, there are 3 current diets that at this period of time that have been actually studied, right? And that is plant-based, which is more like along the lines of Mediterranean diet, okay? DASH, which is low sodium, and a vegan diet, right? Mm-hmm. So what did they all have in common? What they have in common is the fact that it is vegetable-based, that it is oil-based, okay? And we're talking about olive oil-based, not saturated type of oils, okay? Right. Some of them do have nuts, okay, legumes, and that is sort of the base of all of these diets. And the other component of it is that it's all in moderation. It's not like an Atkins diet, right, where you're consuming tremendous amount of fat, right? Because I'm sure anybody could understand that consuming a full plate of bacon may not be very friendly to your heart. That is why it's so important to really find a diet that is in moderation and goes along the lines of Mediterranean diet. Fish-based, right? Trying to decrease the amount of red meat that you do consume. And if you are consuming red meat, making sure the fact that it is lean meat, okay? Because a lot of people who've tried to be more on the vegan side and to stay away from the meats and everything else, because of the fact that not everybody knows how to appropriately supplement, right? They end up having issues with anemia and other components, mm-hmm. right? So I think that being able to do these diets is important. Being able to be actually being monitored with a physician while you're doing it is also important. Making sure the fact that you do get frequent blood work so that you do not become anemic, so that your electrolytes do not become disbalanced, because all of those issues can present other risks to the heart.
What does the study show when your experience is if someone comes in and quite sick, the heart is really not functioning well because they have a long-standing cardiovascular history, changing to a Mediterranean diet, how does that help in terms of reversing the damage or clearing up some of those arteries that may be clogged by the plaques of having had such a high fat diet, maybe a history of high fat diet?
Within that one question, there's several other little questions that I'm going to address. So in reference to how does it reverse? Well, once those plaques are there is nothing anyone can do to reverse the process of them. What we can do is we stabilize them, and that is quite important, right? We start to develop plaque at the age of an early age of 30, and then it slowly starts to build up, right? Other risk factors such as high blood pressure and diabetes and smoking obviously worsen that plaque at a much faster rate. But if you are a healthy individual, okay, who exercises at least 30 minutes a day, 5 days out of the week, and is trying to watch their diet, the thing is that plaque gets to be stable, okay? And that is the important part of it. Now, let's say the fact that somebody already has disease, like you mentioned, and they do have some dysfunction in their heart muscle. How does the diet change at that period of time, right? Well, what the diet does, it controls all of those other scary risk factors, such as high blood pressure. Salt in our food, salt in our diet is incredibly detrimental to our blood pressures. Meaning that if those people that consume more than 2 grams of salt per day, and that do have a history of hypertension or high blood pressure, that worsens their hypertension, and that subsequently puts extra strain on the heart, right? So by controlling your diet, what you do is that you minimize the risk factors that can subsequently worsen your underlying heart disease.
Yeah, so sodium, you mentioned, is a very big challenge for many people because sodium is in so many different foods. How do you begin to teach your patients to be sodium conscious? What are some of the things that you teach the patients to do when it comes down to shopping, the older adult, as they try to shop and prepare their foods? Give me some of the tips that you give them.
So the number one tip that I tell all of my patients is as soon as they come home from a visit with me, they immediately remove the salt shaker from the table. That's number one thing, right? The salt shaker has to go. That's number one. Number two, I actually, in my office, bring up samples of nutrition fact labels, right? And teach my patients how to appropriately read them. Because unfortunately, a lot of people don't really understand how to even read a nutrition label. Mm-hmm. So when it says that a salt content is, I don't know, let's say, for example, 500 milligrams, but that's only in one portion, and they end up eating 3 portions of that. It means the fact that they now consumed 1,500 milligrams of sodium, which is close to the 2,000 milligram or the 2,000 gram sort of limit that they should have to begin with. I teach them how to read those nutrition labels, really as if I were to teach my own child how to do it. In addition to it, I tell them the fact that the salt is a phenomenal product to preserve food, meaning the fact that anything that they're buying that's in a can is going to have tremendous amount of salt.
And nitrates.
So a lot of the elderly, for example, and a lot of those people that actually eat on the go and everything else love pre-made stuff. Love sort of those canned soups, right? Because nothing is easier than to just put it in the can, put it in on the stovetop and warm it up, and all of a sudden. But if you look at a can of soup and the amount of salt that's in the can of soup, you're going to go absolutely crazy. Because an average canned soup has anywhere between 800 to 1,600.
And that's all the sodium for the day almost.
And that's it. And that's it. So you have one can of soup and you're done for the day. Yeah. Similarly with cold cuts.
Yes.
Right? So I teach a lot of my patients, especially the elderly, because they like to have their turkey sandwich or anything of that nature in the middle of the day. I teach them what that turkey sandwich has, including the bread. And that's the one thing that people don't even recognize, is that even bread, certain breads, in order for breads to be fresh and preserved, right, in those plastic bags that we get them in and everything else, salt is being added.
And don't even include the condiments that you add to the sandwich.
Forget about it. I didn't even say anything about the ketchup or anything else at this point.
Exactly.
I am just simply sticking to the foods.
The foods.
And to be honest with you, when I tell my patients and when they really start looking into the salt content in every single one of the food elements that actually goes into their sandwich or goes into their lunch or anything of that nature, they come back to me and they're in utter shock because they said that we had half of our sandwich and that's the entire salt content for the day.
What do you think about the patients who say, okay, I'm going to have the bag of chips, I'm going to have the turkey sandwich with my mustard or whatever it is that they put on the sandwich, and then I'll just I'll double up on my water pill, I'll double up on my diuretic?
Well, what I usually tell them is that they might like their heart, but they definitely don't like their kidneys. Because that's what I usually tell them. Because all that means is the fact that, right, all medications, right, no matter how benign we think that they are, every single one of them has a side effect, right? And when those patients, and Jeanine, you are 100% right, I have plenty of those patients that love their chips and cannot potentially think of having a sandwich without a pickle or two or something of that nature, right? And they're like, we're fine with it. We get a little swollen, but then we take a pill or two afterwards and we're good to go, which is great. I'm glad that they feel better, but their kidneys do not like them because though that extra water pill or two gets subsequently are supposed to get cleared through the kidneys and thus putting extra strain on the kidneys. And our bodies do not work in silos, right? It's not like our kidneys work outside of our heart or our heart works outside of our kidneys or something of that nature. They are all connected. So the pressure that the kidney feels because of the extra pills will subsequently put further strain on the actual heart as well.
Yes, that's such a good point in terms of cardiovascular illness, that it does really speak to the kidneys and every other organ, because the heart is one of those main organs. I know you wanted to talk about something called cardio-obstetrics. Yes. What is important about preconception cardiac evaluation before the woman is anticipating having a child? Is there something that they need to look at or be aware of prior to getting pregnant?
The world of cardio-obstetrics is a new world for cardiologists. I launched the cardio-obstetrics program here at North Shore approximately 3 years ago. And within 3 years, it became one of the most rapidly growing programs here. We get anywhere between 40 to 50 new referrals into the program per week. And it's not because of the fact that I found something new. It was simply because that there was a need And now we have more awareness, and now we have more knowledge. So what does the knowledge tell us? The knowledge tells us the fact that women have a lot more than just reproductive organs. We are a lot more than our care should be a lot more than just the bikini approach to care, right? It's not just, part of my French, it's not just our boobs and reproductive organs. There's a lot more to us, okay? And the one thing that we do know is the fact that preconception counseling is quite important for a lot of women. Why does that matter? Well, those women that have any evidence of congenital heart disease, those women that have a genetic predisposition for early onset heart disease, those women that have predisposition for early onset hypertension, diabetes, cholesterol, all of those things need to be addressed preconceptually. Why? Well, a pregnancy is a stress test on a woman's body. And I refer a lot of patients for a regular stress test. And the average time that a patient spends on the treadmill during the time of the stress test is anywhere between 8 to 10 minutes, right? A pregnancy is anywhere between 36 and 40 weeks, way longer than that 8 to 12 minutes. And I know the fact that we usually don't consider young women that, just got pregnant and are eager to start a family and something of that nature. We don't consider those to be your typical cardiac patients. However, if you were to walk into my office on any Monday, Wednesday, or Friday, you will see that my office is stacked up with young women from the age of 20 to 40 that are either want to get pregnant or actually currently pregnant, or those that have just given birth and have been dealing with what's called adverse pregnancy outcomes that have long-term cardiovascular risks. Okay? This is a new field, but it is the most robust field in cardiology at this period of time because the amount of data that we're obtaining at this moment is incredible, right? In the past, for example, we always thought of something like preeclampsia, right? Or high blood pressure towards the end of the pregnancy that's correlated with protein in the urine. We kind of thought about it as Vegas, right? What happens in Vegas stays in Vegas, right? So whereas with preeclampsia, it happens during the time of pregnancy, the baby gets delivered and that's it, we're done and over with. That's no longer the case. A lot of those women that were in my CCU, in my cardiac intensive care unit, that were there with cardiovascular issues did not have the traditional risk factors. They did not have high blood pressure or diabetes or cholesterol or anything of that nature. They had preeclampsia 10 to 15 years prior to them presenting to me. And now we know the fact that preeclampsia, right, that happened to them when they were in their early to mid 20s is now giving them cardiovascular issues in their early 40s, early 50s, right? Especially women of African American descent, especially women of Hispanic descent. Those are the women that are significantly more predisposed to preeclampsia. And culturally, they believe the fact that, my mom had preeclampsia also. It's not a big deal. She took some pills for a couple of weeks after pregnancy and she was good and we're all good. And the same thing with me, right? So we know the fact that unfortunately we cannot treat preeclampsia as simply something that happens during pregnancy and off we go.
So for those who are listening, what is preeclampsia?
So preeclampsia falls under the major umbrella of hypertensive disease in pregnancy, right? So those women that have high blood pressure before the week 20 of their pregnancy are considered to be chronic hypertensive patients. Those women that develop high blood pressure after the week of 20 are considered to have a diagnosis of called gestational hypertension. Those women that develop high blood pressure after the week of 20 and then they start spilling protein in their urine, that's preeclampsia. That means the fact that the blood pressure is putting strain not only on the heart, but on the kidneys and is beginning to leak protein. Preeclampsia comes in multiple forms as well. Preeclampsia can come in just with the form of high blood pressure and the protein, or preeclampsia can come with severe features, such as seizures, such as heart failure, such as failure of kidneys. Okay, so there's a sort of a degree of how preeclampsia can also be distinguished, but in a nutshell, preeclampsia is high blood pressure towards the end of the pregnancy with evidence of protein in the urine.
So if someone has preeclampsia during their pregnancy or is more prone to be preeclamptic. How does that patient fare post having that baby after, as the years accumulate, maybe in their 40s and 50s? Are we seeing more of a dramatic heart failure because of the stress of pregnancy?
Yes. So the quick answer is yes. So there was a recent study that was done that showed the fact that a 20-year-old female with preeclampsia is at a significant higher risk of developing cardiac disease and high blood pressure at the age of 40 rather than a 40-year-old woman who's never had preeclampsia. So we're seeing that those young women with preeclampsia have a 71% increase of cardiovascular disease.
Wow, that's significant.
Later on in life.
Wow.
Okay, and that is a starking, right? And cardiovascular disease, again, it comes in different forms, right? Cardiovascular disease can come in as premature hypertension, premature coronary disease, premature carotid disease, premature disease of the peripheral arteries, right? When I talk about cardiovascular disease, I'm talking about, it's not only heart disease, it's about every single vessel in our body, right? And our heart pumps blood into every single vessels in the body. So when we talk about cardiovascular disease, it affects everything.
Yeah. So how do you recommend a patient who wants to have 3-4 children and who have been the first child, they really had a severe eclamptic episode during pregnancy. So how do you recommend for future pregnancies? What is your recommendation?
So the first thing is the fact that they have to be able to share that information with their physician, right? If the physician does not know that. And the second one is that that physician has to send them for preconception counseling. Part of my preconception counseling, when I see patients that do have underlying or have had history of any type of adverse pregnancy outcomes, such as preeclampsia, I do a baseline cardiovascular test on them. That means a baseline EKG, a baseline echocardiogram, and a baseline exercise stress test. Why? Because I need to know that even if they're on the treadmill for that 8 to 10 minutes, right, they're able to withstand that stress on their heart. Okay, I'm able to see what happens to their blood pressures upon exertion, right? All of that is quite important. And just getting an EKG, and I think I mentioned it during the first time that we did the show, and that is just getting an EKG is not sufficient. Just because, just think about it, right? When you get an EKG at your doctor's office, you're sitting there nice and calm, looking pretty, right? You're not putting your heart upon exertion. So just because of the fact that you had a normal EKG at your doctor's office gives me, as a cardiologist, 0 to no prognostic features, right? Because it doesn't tell me what your heart is going to be able to do upon exertion.
Okay. Have you ever recommended a mom not to get pregnant?
So unfortunately, I've had to have a lot of those very difficult conversations.
Yeah.
I've had to have conversations where moms fit into what's called a modified criteria for WHO. So the World Health Organization has certain criteria of cardiovascular disease. And there is a modified criteria WHO for that pregnancies are contraindicated. And unfortunately, I've had to have, even just recently, a very, very heavy conversation with both the mom and the dad and letting them know the fact that they are not to get pregnant, right? Because the risk of not only fetal demise, right, but maternal demise is incredibly, incredibly high.
Yeah.
And those are very difficult conversations to have, especially when you're sitting in front of a young couple that is eager to start a family. But the way that I like to tell them is the fact that we live in the world where there are endless options, right? There are options for surrogacy, there's options for adoption, there are other options that if people want to be parents to a child, there's other means of going so without putting your life at risk.
Okay, Doctor, I'm going to turn the page here. Is there a connection between cardiac disease in women and autoimmune disorders such as lupus that you're seeing?
Yeah, so what happens in lupus or any type of autoimmune disorders, right? Let's call it autoimmune disorders because there's so many, right? There's rheumatoid arthritis, there's lupus. I specifically take care of girls, women with lupus because of the fact that some of them are very young. and they come to me as part of the preconception counseling to try to get pregnant, right? So what is the correlation between autoimmune disorders, specifically lupus, or especially lupus, and cardiovascular disease? Well, autoimmune disorders create inflammatory havoc in our bodies, or in those bodies that have actually underlying autoimmune disorders. And when they have those autoimmune disorders, and when there's that inflammatory cascade that gets heightened every month or two, or however often they get a flare, that inflammation ruins and really hurts the inner lining of the vessels. It's called endothelial dysfunction, right? And when that inflammation causes significant amount of endothelial dysfunction, that predisposes to early onset, not only early onset plaque, but actually plaque disruption, right? Where those pieces of that soft, yucky plaque that has now formed, they go forward out and they cause early onset heart attacks, and they cause early onset strokes, and they cause early onset gangrene, because they obscure and obstruct any of the blood vessels peripherally.
For patients that have autoimmune disease that is linked to the cardiovascular health, how do you diagnose that, and how do you make the connection, and how do you explain this to patients who may come to your office that has lupus? What is the lab work that you do, or the diagnostic test that you do for someone that has an autoimmune disease? One
of the correlations that we do have is that when we know somebody's inflammatory markers are significantly elevated, such as whether or not it's a rheumatoid factor or the ANA for lupus, right? That sort of tells us the fact that there is a flare, and we need to really be cautious in regarding to how, I think that we just have to be extra cautious enough into how we proceed with the testing, right? Yeah. But the testing have to be a lot more specific than just a generalized echo or a generalized stress test. That means for those women, I actually refer them for a cardiac CAT scan. A cardiac CAT scan gives us a better understanding of sort of the inside vessels and how much plaque there is, how much soft plaque there's there, and how much of the calcified plaque there's there. And we treat them accordingly. So if we see significant amount of soft plaque that can potentially, like I mentioned, break off at any period of time, those are the women that we stay on top of in regarding to making sure the fact that they take their aspirin daily and that they're taking their cholesterol medication, even if their cholesterol numbers are within norm. You want them to be on that therapy because of the fact that cholesterol medications create what's called a fibrous cap. They put like a little hat over that soft plaque and stabilize it so that that obstruction distally, when the plaque breaks off, does not occur. Mm-hmm.
Wow, Dr. Grayver, our time, unfortunately, is wrapping up, and I still need you to come back and talk to us about
I know, I was going to say, I don't think that we covered everything yet, right?
I want to thank you for being here once again, Dr. Evelina Grayver, the Director of Women's Heart Health at the Katz Institute for Women at Northwell Health, and an Assistant Professor in the Department of Cardiology at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell.
It's a pleasure.
So this is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.